Welcome to Powerful Women Revealed. I'm your host, Nicole Perry, and today we are talking about time, and specifically within medical management. My guest today has been working with the healthcare professionals for over 20 years. She's an independent consultant with her own business, Physician Management Resources, and you can find more information at pmrconsulting.net, where she ultimately helps physicians with many aspects of organizing their offices and businesses so that they can focus on who they really want to focus on, which is their patients. Wendy Gutterson, welcome to the show.
Nicole, thank you. It is so great to be here. I'm so excited to talk about medical management, to talk about PMR consulting, and mostly to spend time with you. Thank you.
You are so graceful, and I love hanging out with you. You are so much fun and very easy to talk to, very easy to work with. Now, you grew up in Brooklyn.
I did.
How long have you been living in Massachusetts?
A long time.
Okay.
So I love the fact that I'm from Brooklyn, but I do describe the first 17 years of my life as forming my get out of New York plan.
I love that.
I was very fortunate that when I was about 10, I went on a field trip, an overnight trip with my camp when we came to the Berkshires of Massachusetts, and I just fell in love. And I turned to my best friend, and she's still my best friend to this day, and I said, Beth, I'm going to live here someday.
Aww.
And when it was time to go to college, of course, I only applied to schools in Massachusetts, and I ultimately came here. I went to UMass, and then I went to Simmons for graduate school. So I'm Massachusetts educated, and I feel like I've always been a Massachusetts resident, but technically I'm really a Brooklynite.
And I love that you love Massachusetts, because it's most people just want to leave Massachusetts and go to New York, but you are the opposite, which I love. Now, have you always known that you wanted to be in the healthcare industry?
Absolutely not. I had so many things I wanted to do, and I have so many things I still want to do. But I will say that working in healthcare has been such a pleasure and has been so good to me and has helped me grow in so many ways. So, I wasn't sure whether I wanted to be a physician, maybe I wanted to be a midwife, and then I realized that there were so many challenges in healthcare. And while it's great to be able to focus on taking care of patients, and that is a sacred relationship and one that I am so in awe of. I realized that I wanted to get into that nitty-gritty of operations. I really loved kind of the problem solving and the organizing, and early on saw a career path in healthcare administration and just ran with it.
Now, you have over 20 years experience. What was the turning point that you decided, okay, I really want to have my own business and not just work for someone else in the industry?
It was this, again, it's a combination of things. I have been incredibly lucky and have worked in some great, really stellar, top-notch organizations. And I've had great people teaching me and working with me and working for me in every job that I've had in, over these past years in management. But I realized that physicians are struggling. It's hard to balance that clinical care where you want to give so much to your patients and be so excellent, and also manage your practice and manage those administrative aspects. And over time, I realized more and more that when I went for my own appointments, I would show up for my doctor, my annual visit or whatever, and I would spend half of my visit answering their questions about how would you organize this, or listening to them talk about conversion to their electronic medical record and their struggles. And I thought, I could probably do a little more even than I'm doing in my hospital or my large organization jobs. And if I have to pinpoint one exact turning point, it was when I realized that people were inviting me out to lunch to pick my brain.
I love that.
I thought, I bet I can do this for more than a tuna sandwich.
Yes.
So Physician Management Resources was born sort of over one of those sandwiches and iced tea.
Now, how often do you actually refer to all of the resources that you know and have acquired over the last 20 years?
Every day, every job that I do, every consulting engagement that I have, and every time I sit down and have a conversation with a physician, I'm pulling from the things I've learned, from things that I've read, from experiences. Often there might be one specific problem that we're trying to pinpoint, in which case I'll bring in another resource, such as an HR executive.
Oh, okay.
Because I've maintained contacts with so many of the colleagues I've worked with, and the healthcare community is both very big in Boston and in Massachusetts, but it's also a small community, and a lot of us really do know each other and know the work that we're doing, and are able to jump in and share our specific expertise on different projects. So when you hire me, yes, you're getting me, and I treat your practice like it's the only practice I care about at that moment, and in fact it is at that moment. But what you really have is a whole host of expertise that goes far beyond what Wendy Gutterson knows.
Now, do you have a large relationship with the hospitals, or really just the physicians and their businesses? And are you proud to be in Massachusetts, where we have Children's Hospital and all these great,
So I'm definitely proud to be in Massachusetts.
Children's and floaters
So for pediatrics, right, we have Children's Hospital, we have Mass General Pediatrics, and we have Tufts, a floating hospital, which is what you're thinking of. But we have so many other stellar community hospitals and healthcare systems, so we don't want to get lost in just thinking that there are these big practices, big academic medical centers, because lots of people get their care not at those major facilities. And the truth is, right now I'm doing a project at one of the major hospitals, or actually two, in another health system, but I'm also working for small private practices that have one physician or four physicians. And the struggles are different, but they're very real in all of the, that's why people hire me, right? Because they're trying to figure out how to do it better, how to ensure patients are getting the best possible service, how to be clinically on top of their game and not let the administrative aspects fall the wayside.
Yes, so really, all of these physicians' offices, and they're real businesses, just like anyone has a business. They have similar struggles, which I find fascinating, because you know, when you think of physicians' offices, you don't think that they have problems behind the scenes.
Exactly right. You think that your physician is focusing on what you're in for, whether it's your annual physical or you're not feeling well, and they're trying to figure out what you need, what test to order, what diagnostic studies, what medication might help you, what therapy. But that physician, if they're in a private practice, is also thinking about how much money they're going to earn, what happened with their staff today, the staff member who is going on maternity leave, who needs backup, or somebody who's moving on to another position, maybe a medical assistant who just became a nurse and is going to be leaving the practice. And so they're thinking about hiring, they're thinking about how to keep the lights on, you know, do they have the right stuff in the waiting room? There are so many different things to worry about, not even to mention kind of the biggies of all of the pay-for-performance measures that are out there, converging to electronic medical records, a new coding system that's coming into place. So these are all the things that your doctors have to know, in addition to having to know why you have a stomach ache, why your shoulder hurts, why you've had a migraine for 14 of the last 18 days. So they need to do a lot of stuff that's well beyond just taking care of an individual patient's patients.
And some of the specific physician businesses that you work with are just a variety: dermatologist and pediatrics and acupuncture. Really, anyone that has a physician's office where they're giving health care or providing health care.
So many of the practices operate in the same way. An electronic medical record is an electronic medical record. Of course, all of the EHRs differ, and you have to structure it so that the needs in a pediatric practice might be very different from the needs in a neurology practice or a neurosurgery practice. But focusing on what that specific practice needs and really listening is much more important than necessarily having a knowledge base of what dermatologists treat. But after 20 years, I've learned a lot about what dermatologists and gastroenterologists and ENT,
So you kind of know, you could, because of all your experience, but it's not really what you need to know.
But I need to know who needs a surgical template and who needs an office-based procedure template. If we're working on electronic medical records, for example, you need to have a basic knowledge of the business, and that's why I've been really lucky to have had so many other opportunities to work with physicians across the spectrum. And right now, I'm working with specialists from probably 8 or 10 different specialties simultaneously, different projects, but different clients, but all the same thing. It's about how do I give the best care and best service to my patients.
And really, what is the one of the most transforming, now you've been on the radio show, so we've talked about this, and I love your answer, the transforming organizational skills that you've acquired throughout all of your years?
Okay, so you know what I'm going to say is
yes.
listening.
Yes.
Listening is absolutely paramount. And when I go into a new practice, the first time I meet with you or the 20th time I meet with you, I focus on what you're saying. People who've worked with me know that I take incredible notes. I'm constantly, well, now I don't write anymore. I have this little teeny laptop, and now I'm typing furiously. And I can pretty much read back to you what you've said to me.
Wow.
So I really, really focus on listening and understanding where the problems are, where you need support. Because although you may have a challenge that I've seen before, you may not be approaching it the same way, and you're certainly bringing a different skill set to it.
Now, what do you mean they're not approaching it the same way? Or they're not able to see a different way of looking at it?
No, what I'm really thinking is what expertise is already in that practice, what skill set the practice has, and where there are gaps.
Okay.
So if we stick with our electronic medical record example now, because that's a hot topic, and
yes.
you talk to physicians, everybody, or often, there are complaints about how hard it is to use their electronic medical record or how hard it is to convert.
To convert, yes.
Right? Whether you're converting from paper to EHR or from an existing system to EHR. So one practice might have a physician who's really computer savvy and is ready to go, and the struggle is that they need to figure out how to get all of their paper records into their EHR. But they're not struggling to create new templates. They're not worried about how to use the computer when they're talking to a patient. But another practice might be just throwing up their hands and saying, how am I going to do this? My patients don't like it when I have the computer. My staff doesn't know how to use it. We're starting from scratch. So really getting down to what's the core that's driving you to be so worried about this. And again, I ask tons of questions, and then I think about what's the action plan, what recommendations can I make for your office that are really going to serve you, your staff, and your patients well.
And I love how you ask, really, right, you cut to the chase, what keeps them up at night?
I always ask that
right?
question.
Because they know what keeps them up at night, and they usually know the answer to that question very easily.
Think about it, gives me such insight into what's going on, right?
Yes.
So yeah, that is one of my favorite questions. I have a few other questions up my sleeve.
Yes.
But that is one that I always ask because it helps you understand. And sometimes it's hard to articulate what it is about your business. That you might have a sense that it's not going well, that perhaps you're working just as hard as you ever did, but you've noticed that your revenue is declining. Well, that could be a result of coding. It could be a result of denials. It could be a billing process
Lack of coding.
issue.
Lack of
It
coding.
could be coding incorrectly. It could be not maximizing, not so much incorrectly, but maybe some education about how to maximize coding and understanding why insurers are denying payments. It could be that nothing has really changed in how you're billing, but your clients have changed, your patients have changed so that they have different insurers. And insurers pay at different rates, right? So you could be experiencing that. If you have a big shift to one of our government payers, you might see a decline. So we really look at so many things and get in there and do that financial analysis. If you say to me, I really want you to work on my EHR, and when I ask you what's keeping you up at night, you say, I'm making less money. I know where to focus. I know what to look at.
There you go. Right. Exactly. So that gives you really a huge insight as to what you really need to dive into and sort of uncover. And really, you're a consultant. And we talked about this. My husband's a consultant, and you have amazing businesses because your skill set, you really have to be skilled in so many different things.
I think what you really have to do is like people.
Yeah.
Right? And you have to be good at problem solving. There's no doubt about that. Mm-hmm. There's nothing more relaxing to me than crossword puzzles or kokoro or ken. I love those Japanese math puzzles. I'm really into that. But definitely, I start my day and pretty much end my day every day with a crossword.
Really?
Yeah.
Well, you're very easy to talk to, and I can see how you would be a really great mediator between the physicians and their staff as well. So how do you have to generally bridge a gap between?
So not so much, because typically
they all get along and because they're working together.
Co-workers, they do work together. Sometimes I might work with a physician or a lead staff person to kind of amp it up a notch.
Yeah.
To say, let's maximize performance. What if we did something differently, right? Because you do things the way you're taught to do them, or you do things the way you think, and unless there's an intervention, you keep doing it that way.
Exactly.
And sometimes there are different ways, and one of the advantages of bringing somebody like me in is that I'm bringing outside eyes. I don't know how you do it in your practice.
Yes.
But I know what has to be done. I understand what the desired state of affairs is. I understand where you want your practice to be, and I can usually work pretty well with your staff to get there.
Yeah, and really helping the staff to love their job again. Because sometimes you come into different offices and they have frustrations. And is that one of the things you love the most?
Oh my gosh, that is such a win.
Yeah.
That's like, it's not baseball season yet, but I always say that's my home run. When the staff say to me, it's been so great having you.
Yeah.
When they feel re-engaged. And often that just boils down to clarity of roles and to listening. Staff are smart, right? They chose to work in medicine. They have to know a lot also.
Yeah.
Right? So medical assistants, nurses, receptionists, the phone people, they're working really hard. And everybody is working for that same purpose, right? To serve the patient. And I find that when I go in and I talk to staff and say, well, what would you like to do? If you could change one thing about your job, what would that be? They know.
Yeah.
They're not hesitating to tell me.
Yeah.
Often they have more than one thing, and we deal with that.
Well, I'm sure they really confide in you, right?
Yeah, they do. But what it speaks to is how invested they are in doing a good job and doing right by the physician or nurse practitioner or PA who they're serving, and also doing right by their patients, because they feel just as invested in the patients who come in.
And now, so why are you so passionate about helping physicians and helping their staff? I know we've talked about this where they've, asked to pick your brain when you go in for your own appointments. But really, why are you so passionate about helping them see clarity and get organized?
I think that it's just a big opportunity. I think that in Massachusetts, certainly in so many other places, we have so much medical knowledge here. There's no doubt that you can get incredibly excellent clinical care, right? Everybody talks about it. Everybody knows it. Look at the medical resources. We have 3 medical schools right in Boston. We have a 4th if you count UMass, right? So just outside of Boston. So Massachusetts has a wealth of clinical expertise, no doubt. Fantastic physicians, and many of them. But as a healthcare industry, we're struggling here. We're struggling to figure out how best to use our resources. We're struggling to figure out how best to engage patients in their care. You hear patient-centered care, right? You've heard that term. That doesn't necessarily mean making sure that there's an awning so that when the patients pull up, they don't get wet coming into the building.
There's no red carpet.
But what it does mean is involving patients in making decisions about their care. So if you think about the administratively, think about it as physician-centered administration, right? How do we help physicians feel empowered to make their practice the best practice they can be and have the best outcomes? Physicians are hardwired for good outcomes, right? That's what they're working for.
Yeah.
So why not look at that opportunity to make the administrative piece as positive as the clinical piece?
And I love how you say that, typically when someone goes to medical school, they're not thinking, I want to have the best practice, that I possibly can. They're really not thinking about that. They're thinking about, I want to help patients.
Absolutely.
Some of them do need help behind the scenes in the office environment part of it.
For some physicians, that's really a struggle, absolutely, to work on that administrative thing, the administrative piece of it. I find that I've not yet met a physician who hired me and said, I really came out of medical school thinking it would be fun to run medical practices.
Yes,
right?
yes.
But you're right. Physicians are very, very invested in their patient care. Running the practice is a piece of it. It's harder and harder as a physician to find that autonomy. So private practice gives you a little bit of that, right? You're definitely answering to insurance companies and payers, and you're answering to your patients, to your public as well. But if I can support them and have physicians focus on taking care of patients, that's such a win, right? That feels so good.
And typically, change is growth, but not everyone is open to change. So really, how do you get them to be open-minded and see that, if they just do something a little bit differently, it will really help their practice significantly?
Sometimes that's hard.
Yeah.
But it's just based in conversation and really understanding what is it that you want to do. To tell me, sit back, close your eyes, describe the perfect day at work to me, right? And as the physician starts talking about that, I'm typing furiously, but I'm also thinking, what can we change? What does their day really look like? What's the current state of their practice, right? What's the reality of today? And what is that they want their practice to look like? And if you can create that recommendation or a set of recommendations that bridges that gap, people listen and people want to do it. I mean, they've already invested in hiring a consultant. They've already invested in their office. They want to make it as positive an experience for everybody.
And now, I know that on your website it says that you bring, a fresh set of eyes and fresh ideas. And we did talk about this on the radio. How do you constantly bring new ideas when you've been doing this for so long? Is there anything left? Is there always going to be something new?
Well, the playing field keeps changing, right? 10 years ago, we weren't thinking about meaningful use, right?
What is meaningful use?
So meaningful use is the government investment in physician practices and hospital systems, but for outpatients, that creates fields in your medical record, a way to document in the medical record that will make tracking information more meaningful, that will help your patients. So focusing on things like tracking whether or not somebody smokes and that you've counseled them to quit smoking. Tracking various measures for diabetes, for other chronic conditions. So
whether it be themselves or their previous family,
history,
yes.
all of that. So meaningful use was a sea change in how physicians started documenting, because there were structured fields that you needed to document into. Right? So we weren't thinking about that. So now meaningful use comes along. All of these pay-for-performance measures, or P for P, you might have heard them referred to as. It's how insurers now pay. Instead of you come in to the office, you had an office visit, so the insurance company pays for that office visit. Now there are different layers.
Very specific.
There are different layers of how it gets paid. So certainly we're seeing different challenges all the time. So there keeps being, we don't have to think outside the box, because there keeps being new boxes to think of. But I'd like to think that PMR Consulting does think outside the box, because we're in so many practices every day. I think of myself as going in and teaching, but I'm also going into practices and learning. I always am learning and listening for something that maybe will help a client down the road.
Yeah, and I love how you say that, there is no Wendy Gutterson enterprise. You're not cloning all of these offices to look exactly, you really are customizing in order for, or in accordance to their needs and their staff and their situation and their environment.
Right. I mean, this is about you, right? When I go into an office, it's not about what Wendy Gutterson needs.
Yes.
Right? It's about what Dr. Perry needs, because that's what we want to focus on. You hired me to come in and help you solve a problem. You didn't hire me because you had an extra, whatever amount of money hanging around and you didn't know what to do with it.
Yes.
You hired me because you're trying to figure something out, or because there are things in the way of having you be the best clinician you want to be. And so my goal, and what I pride myself on, is breaking down whatever that barrier is and allowing you to be that doctor or that provider that you went to your training for. You worked hard to become a doctor, to become a clinician. Let's let you do what you do best.
Now, what are some of the tactics and strategies that you do outside? You talked about this on the show in your office. You have what?
I did.
Sheets up all over your office. What do you do? Because I love how you describe that if you can write, well, I'm going to fill it in for you. If you can write everything on that board and stare it right in the face, that is just so powerful.
So people who work with me know that I love flip charts, right? So I carry a flip chart in my car all the time. I have lots of colored markers, and I'd be a little embarrassed for somebody to come into my office because the walls are literally plastered
with flip
pieces
charts.
of paper, with flip chart sheets that maybe I've created with you. Or sometimes I'm thinking about, okay, so what's going on in that office? What needs to happen? And I'll just start writing. I mean, literally, I love to write on the walls. Whiteboard walls would be perfect for me, except I never want to erase anything. So maybe the flip chart is the way to go. I'm working on a project now that's very data intensive. And I started printing things out, like different sections of the data that I need to think about, and sort of taping them
up to the flip charts.
All over the walls. My office is crazy now, but it was a breakthrough for me. I was able to see the relationship between what was going on with physicians struggling in their practice, their tenure in the practice, what's happening with their staffing levels. Like, it all became clear because I could stare it in the face and think about what's on this piece, what's on this piece, what's on this piece, and pull it together. So, I'd like to look at it. I like to look that problem in the eye.
Yes. Well, and how many years in management? Has it been 20 years all in management? No.
So I've been in management for about 20 years.
Okay.
Yeah, I got my first management job a little more than 20 years ago.
Okay.
My first management job was a small management job, and then the next one, and the next one, and always, I just have been so incredibly fortunate and blessed to work with people who are smart, who are nice, who are great teachers and great role models. So, and hopefully I have a good memory, and I've learned from many lessons over the past 20 plus years, and I use them and I bring them in to those meetings and think about what's going to serve you in your practice the best.
Now, what do you see as one of the most common challenges that practices have? Is it staffing? Is it retaining the staff? Is it?
It's probably the changing technology.
Okay, so we're going to talk about that too, the ICD-9? We can talk about that now.
So it probably has to do with keeping up with changes, like coding is a good example. So ICD-9 is how we code diagnoses right now in this country. So and every time you go to the doctor, you have hypertension, so they code you as a 401.1, and you have diabetes, and that's a 250.00, right? So and that's how the insurance companies know what's going on. That's how data is tracked, and it's also how we know that the procedure matches what the patient has. Right? So it's a good system for payers. We're going to an ICD-10 classification, which is just going to give us way more information, and the number of codes is just going to explode. So what's going to happen is all practices are going to have to change how they approach coding. Right? Now, I mean, I'm slick. I know 2 codes, right?
Well,
there are thousands of codes out there, and there are going to be thousands and thousands more codes, right? But what's important is that that office, every office, has a systematic approach to how coding is going to occur, because we're going to see a lot of denials. So there are technology changes. There are billing providers and electronic medical record providers where we can look at your note because it's in structured fields and pull words out and help you with your coding. But all of those things require some knowledge base to be used correctly. But even before you can use them correctly, you have to figure out which one to use. There are so many products out there. So when I say keeping up with technology, I expect physicians to keep up with clinical technology and their clinical knowledge base, and they do that through their continuing medical education. That's nobody's asking me to help with that.
Yes.
But I'm not expecting physicians to keep up with what are all of the different ways to approach ICD-10 coding.
Yeah.
That would be crazy. We want doctors focusing on patients.
Now, for the person who is not in the physician world, is ICD-10 similar, or is this the meaningful use? So I wrote down meaningful use earlier. So this is for the person who's not in the medical field.
Okay.
The ICD-10 is the new coding system, and what the meaningful use is the government?
Meaningful use has to do with the electronic medical record. So physician offices were given several years to ramp up and introduce an electronic medical record. Get off paper.
Okay.
So we want to track things electronically, and we want to document each visit in a computerized system. And there are lots of good reasons for that. It allows us at the end of a visit as a patient to leave with a printout of what happened in today's visit, what medications we're taking and why we're taking them. What is happening next? We've been referred to an endocrinologist, or our next follow-up appointment is going to be in 6 months, or we need to go for a mammogram.
So that's the meaningful use.
So
yes, because I walk away with a piece of paper now.
You didn't 6 years ago.
No. Oh my God, it's all coming together for me.
So it's because your doctor's office, from whatever system they were using, they might have had an electronic medical record already. Many, many practices did.
But they weren't giving the patient anything.
Well, some might have been, but most likely they weren't, and they certainly weren't mandated to do it, nor were they incented to do it. So this was an incentive to install this, to implement this electronic medical record, and to use it in ways that are meaningful.
Okay.
Right? And meaningful can help the patients, meaningful can help the next provider who's going to see that patient. It allows doctors to share information a little bit easier. And there are thousands or hundreds of meaningful use measures that are out there, and each physician's office had to pick the ones that were most appropriate for them.
Okay. Now, so we've talked about a lot of things right now. We do have about 10 minutes left.
Okay.
I do want to know, what do you take pride in the most about the services that you provide?
So, of course,
I mean, you love walking away. I can see it in your eyes. So you love walking away helping people. I know that.
Yeah, I love it when I meet with like a whole practice, the staff and the providers, and at the end of that meeting, the staff look really relieved and happy.
Oh, what a great feeling.
Because sometimes, particularly as a support staff person, you go into a meeting and think, oh, what's going to happen to me now? Right? What am I going to
Or how much more work am I going to have to...
Exactly.
And they already have a 40-hour week that they're already doing so many things. They don't have all this extra time.
Or that 50-hour week they're trying to cram into 40 hours.
Exactly.
Right? There's lots of information and there's lots of work to be done. So definitely, I love it when the staff are on board. I like it. You're talking about when I walk away. I actually like it when I walk in. And the staff are happy to see me. That's the real plus. Right?
Oh, so great.
So I love it when the staff call me. They know they're coming in, and I'm driving down to an office, and my cell phone rings, and they say, "We're ordering lunch. Do you want something?" Right? Then you know that you're part of the community, because that's one of the things about working on your own is where are your colleagues?
Yeah.
So, I see my colleagues who are other consultants who I work with, or when I bring people in, and certainly my clients I work with. But day to day, I could be in my office for a couple of days. So, so creating that sense of partnership is really, really important to me. And when the physician or the staff feel like I'm part of their practice, then I feel great.
Yeah. Now, what is the process? Because ultimately, you're coming in, you're consulting, you're giving advice, you're given a diagnosis of what they're doing and what they could do to improve upon their practice. What are
So I do exactly what your doctor does, right?
Because we get the diagnosis, you're getting the same thing.
So you're sitting in the exam room, and the doctor walks in and says, "How can I help you today?" Right?
Yeah.
So I'm sitting in the conference room, and the doctor walks in, and I say, "How can I help you today?"
Yes.
And then I ask my questions, and I listen, and I make my diagnosis. And my diagnosis is something like, "Oh, we need to streamline your systems," or "We need to look at how we're checking patients in," or "Maybe the process would be better if we did this." And in medicine, there's something called the differential, right? So your differential diagnosis is all of the things that it could be.
Oh, okay.
Right? So we start doing diagnostic testing to narrow down what it is and hone in on the right treatment for what you have clinically. And it's really the same process.
And what is the time frame? I mean, do you see things coming together over several weeks or several months? Does it depend
It really depends.
on how quickly they want to move forward with different systems?
Right, and how much we have to explore versus how much they have ready to share. Right, so some practices have a lot of information at their fingertips, and they can tell me what's been happening in the practice. They can give me data that I can then go back and process pretty quickly. I'm a little bit of like a numbers geek, and I love data, and I love getting numbers and pulling it all together. So, but sometimes we don't really know what's going on, but we know that we've had a ton of staff turnover.
Yeah.
So to help us with that, or we're looking at this new revenue model, help us figure that out. Or we really want to grow the practice. We think that we're in an underserved community, but we don't know how to hire additional providers and how to make sure that we can sustain that while they're building their practices. So some are longer term fixes, and sometimes it's a simple one-on-one engagement. But the whole process starts with, no surprise here, with that phone call or that email inquiry, and then me just listening to the practice and understanding.
And you're really helping with many different aspects. Your website is very easy to navigate and very to the point. I love when there's no fuss, no muss for websites, and I don't. And you're in a very technical field, and your website is not technical. So I feel like it's very easy to understand, even for me, and I'm not in the physician business.
Thank you.
So you're basically helping with human resources. You're giving overviews to their actual practice, like general evaluations of what they could be doing, what they could see doing differently. Their goal setting, financial evaluations, business growth, the revenue analysis, really everything, and the transition management. That's the ICD-10.
That could be the ICD-10. It could be succession planning. If you have a managing partner who is going to be retiring in the next few years, what's going to happen there? Maybe an office manager who's going to be leaving, something like that. So, when I was working full time as an employee, I managed multiple departments, and those were all the things that I worried about, and that's what kept me up at night. So I started thinking about the kind of services that I had been doing and that I could supply. Now, nobody asks me to come in and do everything, but somebody might ask me for help with human resources or help them plan for their future.
Or give you that referral or that connection.
Exactly.
And help them out in that aspect.
So whatever that practice needs. The other thing is, if a practice needs something that I don't offer or I feel is outside my wheelhouse, I know who's going to be able to help you.
Yes.
Right? I know where to refer on to. So far that hasn't happened, but but I'm sure that there are going to be projects that just are outside the scope. For the most part, though, if you have a clinical practice and you have outpatient practice and you need to figure out what is going on in your practice or want to make some kinds of improvement or changes, I'm happy to come in. We start with that initial conversation and then figure out what kind of action plan, what kinds of consulting services you need.
And so even though it might take them several weeks or months to have everything finalized, you can really give that diagnosis very quickly.
Often. At least the differential.
Okay, so tell me, we talked about this on the radio, if you could change one thing, and I loved your answer, what would you change in the healthcare industry?
So the question that I think you asked last time, I'm not sure I'm wording right, was what one thing for physicians would I like to see change?
Yes.
Right? And my answer, and I still stick to it, is that I would love to see physicians be able to spend more time talking with patients.
It's a beautiful answer.
And I think patients would love to see that, and most of all, I know doctors would love to see that. There's no doubt. There's nobody who says to me, I love practicing now when I have to do 8-minute visits or 15-minute visits.
Yeah.
Nobody has ever said those words. Right? But what they do tell me all the time is the time crunch. I hate how quickly I have to see patients. I don't want to be double booked.
Oh.
So my job is to come in there and help figure out what are the other things that we can take away from the administrative burdens of running your practice so you do have more time to spend with patients.
Okay, so the administrative, if they just balance that out a little bit more, they will have more time.
I sure hope so.
Yes.
That's the plan.
Well,
time that you're not spending interviewing for new staff or dealing with staff turnover or fighting with insurance companies or even working seamlessly with insurance companies, time that you're spending on administrative tasks is time that you're not spending taking care of patients.
Yeah, and is that one of the most common things, is the time being spent with the insurance companies?
There's every practice that wants to get paid is spending time with insurance companies. There's no doubt about
well,
it.
that's one commonality that I feel like we're on the same team. Like the physicians and the patients or the clients, none of us like the insurance companies.
Well, and you know what, I wouldn't even say that because the insurance companies play such an important role in what we're doing here.
I know,
So
but we
I
almost
wouldn't say
always feel like we're getting shafted, we're not getting everything that I pay a lot of money every month for medical insurance that I never use.
Oh, but you know what?
I know.
But when you use it, you really need it.
I know.
And so,
I know.
So, insurance is meant to be insurance. We hope that, and the insurance companies also hope that you never need that, not because they want to make more money necessarily, but because who wants to wish that people are going to be catastrophically ill?
Yeah,
right?
I know.
So, but
you're so positive. I love it. I love it. It's very refreshing because it's an industry that a lot of people don't look at with such. In your eyes, I can see how you admire these physicians and all the people that work in the offices.
You know what? I've held a lot of those jobs. I've been a medical assistant. I've been that medical secretary. I've been that front supervisor. And I feel like it's a privilege to take care of patients, no matter where you are in that practice. It really is. People are coming in. They're sick.
They're not at their best.
Scared. They're not at their best.
It takes a really special person to work in that field.
And aren't we lucky that so many people in Massachusetts want to do that?
I know.
Right?
I know.
So it's another reason to love living here.
I know. And we need to love our physicians and their offices because we need them. We need them.
We do. And when we show up, we're really not at our best.
I know. I know.
These are very, very special people.
I know. Well, we are out of time. Is there any one last thing that you want to share?
Thank you so much, Nicole. It is such a pleasure to be here. I love talking about my business. I love talking about physician management, and it's great to spend time with you.
Oh, thank you so much. And you can find Wendy at PMRconsulting.net for more information. I want to thank you for tuning in and watching Powerful Women Revealed. I hope you'll tune in next week, Tuesday nights at 7 p.m. And until next time. I want to thank you so much for watching the Powerful Women Revealed show. The Power Show is a compelling way for entrepreneurial women to capture and share who they are, why they are so passionate about what they do, and how their business is unique and stands above the rest. It is so important as entrepreneurs to communicate who we are and why our products or services are exceptional, and communicate that in a powerful way. My guest today is a powerful woman revealed. Wendy is clearly devoted to helping physicians run smoother practices so that they can focus on what they really want to focus on, which is their patients. Wendy truly has the ability to inspire physicians as well as their staff with her years of experience and knowledge in the healthcare industry. What I absolutely love about Wendy is that she is so down to earth and so friendly and easy to work with. She can clearly be an amazing mediator between the physicians and their staffs, and she understands from being in the healthcare management for so many years how to make any physician's office run very smoothly. Wendy is able to articulate what her mission is with her consulting business with such ease, and why she is so passionate about helping one physician's office at a time. Wendy's consulting position and business is such a noble one, and she deserves recognition for her expertise and her drive as an entrepreneur. Wendy is such an inspiration to me and many people with her kind and gentle nature, as well as her words of wisdom. It is my personal mission to acknowledge such amazing women entrepreneurs such as Wendy, and I am extremely blessed to know Wendy and promote her and her consulting business. When Wendy refers to physicians, she does so with such sincerity and optimism. We have really gotten away from appreciating our physicians in today's society with all the challenges that we face as patients. And Wendy brings her appreciation for our physicians as well as the other practitioners back to the forefront where it needs to be. The Power Show is about strengthening who we are together, empowering women of all ages to follow their dreams, and inspiring the women of our future generations to be the change that they want to see. The show is so much more than a show about embracing our own vulnerability, communicating our beliefs, and bonding with other powerful women. I have the pleasure of meeting and knowing some really amazing women such as Wendy Gutterson, and I am absolutely honored to promote them, what they stand for, and how they are helping people in and beyond our communities. I hope you will tune in next time. Until then, I'm your host, Nicole Perry, and I want to thank you for watching Powerful Women Revealed.